Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
This is Medicare Moments with your host, Toni King. My name is Jim, and welcome to today's podcast. Hi, Toni.
How you doing, Jim? And Medicare is growing. We're getting ready for our annual enrollment, which starts in October. People are being bombarded right now because they're getting ready.
Bombarded is the word. There's lots of things in your mailbox, and you're probably, if you're like me, even I'm getting calls from people saying, I had one today earlier before this podcast saying, are you aware of all of the new opportunities Medicare offers you? And I hung up because I am because of you, and I don't need them to tell me what to do.
Yeah, and Medicare has not released what's going to happen in the fall, so you can't believe anything anybody's saying.
Well, Toni, Medicare basics for baby boomers. So, and I'm a boomer, you're a boomer. We know a lot of boomers.
I've been booming all the time.
Stephanie writes you and says, Dear Toni, I'm a confused baby boomer. Now, I never thought there was such a thing, but Stephanie says she's a confused baby boomer who needs to make my Medicare decision in November when she turns 65 years old. Don't know where to start or what to do. Can you please help simplify this ordeal? I think she came to the right person.
Well, you know what's really bad is about 6 months prior to getting on Medicare, you start getting information. And I think, I don't know who sells everybody's information, but somebody sells your information about turning 65, whether it's coming from the driver's license organization. I mean, how would someone know that you're turning 65? But they sure do. They sure know our birthday. And you need to realize that they're coming to get you. And you better be careful because your Medicare dollars is what they're looking for. Did you know, Jim, that there is a person getting on Medicare every 8 seconds for the next 10 plus years? They said they can't even keep up with how many millions of people are going to be on Medicare.
Wow, that's a lot. That's a lot, Toni.
That's a lot. One person every 8 seconds.
You're going to need to grow more arms and hands to do all that paperwork. That's what I'm saying.
I'll be an octopus.
So here are some of the basics, and Toni takes it to the very, very basics because everyone needs to start there. And being prepared is what's best. And Toni has said before that you have to be preemptive and you have to prepare. And you don't get a chance to really do a redo, right, Toni?
There is no redo. Once you have your chance and you're supposed to get on Medicare, if you miss it, you're in big trouble. All of this information that we're talking about is in my Medicare Survival Guide Advanced Edition and also in the Confused About Medicare video series. Video series goes in depth, and they're both on my website. So if anybody is confused, they can go online and purchase those.
And Toni's website is tonisays.com, which is TONISAYS.com. And that's where you can get all of that information and more that Toni was just talking about. So, Toni, you say the first thing to do is to enroll on time.
You got to know when you've got to enroll. Are you turning 65? If you're turning 65, maybe you're getting your Social Security check. You will automatically be enrolled because Social Security knows that you're turning 65. They're the ones that does all the enrolling. You'd really think Medicare would be enrolling you in Medicare, but Social Security does all the enrolling. So if you're getting your Social Security check and you're at 65, you'll automatically get your card. If you're not getting your Social Security check, like I wasn't getting my Social Security check, you weren't getting yours, we had to go online and enroll. And had you not talked to me, you wouldn't have enrolled.
Correct.
That's right.
Social Security enrolls you in Medicare. So, Toni, But Medicare is free, right?
Medicare is not free.
What?
Everybody thinks it's free. No, you pay taxes for Medicare. You pay taxes. That's where your tax dollars come from. Okay.
So what is Medicare expecting me to pay?
Well, it depends on what your income level is. Most people, their Part B premium is going to be $174.70 for 2024. It's depending on what your income level is. If you make more money, too much money, you'll pay more in your Part B. But the average person generally pays $174.70 generally.
Okay, so that's what you're paying. But once you're in the program, there are deductibles, right?
Yeah, they always have a deductible and it changes every year. This year, your deductible for Part B is $240. I am on a Medicare supplement. I have Plan G. That's the one that I could enroll in. My out-of-pocket is $240. That's it. I pay a premium for my Med Sup and my out-of-pocket's $240. My Medicare supplement works with original Medicare. I have every hospital and doctor nationwide. I don't have to worry about it. But a lot of people go with Medicare Advantage plans, which is Part C, and that's part of number 3, which is the alphabet soup.
And we're going to talk about the alphabet soup when we come back right after this break. Don't go away. You're listening to Medicare Moments with your host, Toni King.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome back to Medicare Moments, and we're doing the Medicare basics for baby boomers. As when we left off, Toni was talking about the alphabet soup. You might have eaten alphabet soup as a child, Toni. I mean, I did occasionally. We even had alphabet cereal as a child.
Oh, yeah, definitely. The ABCs. We definitely had alphabet soup.
So now we're talking about Medicare, and Medicare has a Part A, a Part B, a Part C, a Part D. What are we doing?
That's just the parts of Medicare. A and B is original Medicare. That's how it got started. That's original Medicare. You have to get Part A and B, and then you can get an Advantage plan if you decide you don't want to go with a Medicare supplement that's going to pick up what Medicare doesn't pay for. Some people like the Advantage plans because they want the zero premium plan, and they say, I'm never going to get sick. I'm not worried about it. I'll do something at a later date. I'll pay a premium at a later date. So Part C is your Advantage plans, which is an HMO or PPO. And then Part D is your prescription drug plan. And we will be having webinars, or we will be having new Zoom meetings on Part D starting next year, because there are going to be some serious changes. By law, we cannot talk about what the changes are for 2025 until October 1st. Then we can discuss it. But there will be serious changes towards prescription drugs, and it's to our better benefit.
And Medicare Part D is all about your prescription drugs.
Correct.
Okay. Medicare does cover a lot. Toni says Part A covers inpatient hospital, skilled nursing, facility care, home health, and hospice care. And Medicare Part B covers physician services, outpatient surgery, lab, x-rays, MRI, durable medical equipment, and preventative services. Correct, Toni?
Correct. Medicare covers a lot. There's things that Medicare doesn't cover that people, Medicare's not going to pick everything up. And if you have someone who is at home and has a health issue and needs somebody to come to their house and take care of them, Medicare's not going to pay for that. They don't pay for at-home visits. The home health company will come and visit you, but they're not going to stay there but maybe 15 minutes. They're not going to be there the whole day taking care of you. So that's where long-term care comes in. Medicare doesn't pay for dental. Medicare generally doesn't pay for glasses. Original Medicare doesn't. or your hearing. That's where some of the Medicare Advantage plans will take care of that. So you got to really look at it. Talk to your doctor and find out which plan best meets your needs.
Toni, is there a Medicare network?
Is there a Medicare network? No,
Yes.
There is not. There is no network to Medicare. It's original Medicare. You have every hospital and doctor that is accepting Medicare. As long as your doctor is accepting Medicare, you just go, you use him, he files a claim with Medicare, and off you go. You haven't had a problem with the doctor. I have not had a problem with the doctor. It's been seamless. It's very easy.
It has. And, when we talk about Medicare on this podcast, we always talk about people turning 65 years old. 10,000 a day are turning 65 years old for the next several years. But Medicare also serves some people under 65, right, Toni?
Medicare serves some people under 65, and the same rules apply. That's under Social Security disability. But one thing, Medicare also serves people that are over 65 that are leaving their work. So what happens if you're past 65 and you never signed up for Medicare because you're still working? There's certain rules and certain ways that you need to enroll, and we have podcasts on that. And we have articles about the forms that you need to use. So people can come to the website, tonisays.com, TONISAYS.com. I've got the book, Medicare Survival Guide, which goes through how to enroll in Medicare when you're past 65. And we've got the Confused About Medicare video series that goes in depth on everything. And so we're there to help people understand what their situation is. So you have people who are turning 65 and they're getting on Medicare. They've got their Social Security check, or they don't have their Social Security check and maybe they have an individual plan. And then you have people who are past 65 and now they need to get on Medicare. Because people need to remember, with Medicare, it is what you don't know that will hurt you, and it will hurt you over and over.
This is Medicare Moments. Toni King is your host. We'd like you to share our podcast with your friends. Tell them about it. Make us one of your favorite podcasts. We have a brand new podcast dropped every Wednesday morning for you. So we're here for you. Toni's there 24/7. You can call her National Medicare Helpline at 832-519-8664, 832-519-8664. And you can go to tonisays.com, TONISAYS.com. Toni continues to improve and put more features on her website. And so that's really the best place to start. Go to Toni's website. And if you want the webinars, if you want the books, if you have a question, you can email it to Toni, info@tonisays.com. Everything is there for you. And we really encourage you to go to the website and take advantage of everything that Toni has to offer. So folks, thanks for listening today. And Toni, back to you.
Well, thanks a lot, Jim. And you go have fun. We're cleaning up after the hurricane. That was a hard hurricane. I'm still picking up branches.
They were everywhere. There's a lot of limbs down, a lot of just post-hurricane work to do. And the pre-hurricane work wasn't fun either. So yeah, it's a lot of work all the way around. So thanks, folks, for listening to Medicare Moments.
I'll see you later, Jim. Go have a good day.
Well, hi, I'm Lori LeBay, and I wanted to tell you about Alzheimer's Speaks, which is another great podcast. You see, my own mother lived with dementia for 30 years, and I felt lost. Did you know every 3 seconds someone in the world is being diagnosed with dementia? Odds are it's going to hit your families too. We want to help you connect to services, products, tools, research, and stories so you can be prepared. Please subscribe to Alzheimer's Speaks on your favorite podcast platform.